There is one organ which causes high blood pressure, and it's not what you think. And there are specific exercises you can use to target and fix your blood pressure easily. No diet, lifestyle changes, or medication required. Check the link in the description below, but for now, today's question.
The question: what is the difference between hypertensive emergency and hypertensive urgency? Answer by John Nagel. A hypertensive crisis occurs when an individual's blood pressure very rapidly elevates to potentially life-threatening levels. The condition is divided into two categories. A hypertensive emergency is the form of hypertensive crisis where testing shows that there is acute damage to various organs in the body, most commonly. A hypertensive urgency, on the other hand, is when the patient has a severely elevated blood pressure with no findings on testing, but still having significant symptoms related to their high blood pressure. It is important to know that there are no specific numbers to define a hypertensive crisis. The BP must relate to both timing and symptoms. I'm much more concerned about someone with no previous BP problems who has a BP of 190/100ths within the EKG showing a heart attack than I am concerned about someone with a BP of 240/160 who has no symptoms and hasn't taken their BP meds for 2 months. Certainly, the latter case needs long-term control, but they aren't in a hypertensive crisis. Answer by Nikhil Jha. In emergency, there is evidence of end organ damage like proteinuria of kidney, or blurred vision papilledema, encephalopathy brain or angina, frank/flash pulmonary edema. However, in urgency there is no evident end organ damage. Answer by Vera Mavzarevic. Generally, there is no difference. You have to go to the doctor fast and have the hypertension dealt with. The small difference might be how fast you have to see a doctor. If it's urgency, it means ASAP, like today. If it is emergency, you have to go to your ER now.